Hello, David Barron here, also known as Dantalian Jones. I want to take this time to sort of give you somewhat of an update with me, and I want to talk also about what it is hypnosis can really be useful for. First of all, the update with me is that just over the past couple of years, I've had this really intense lower back pain. Just recently, I got some x-rays, and it's not my lower back, but it is my hips. Osteoarthritis. They actually recommended an intense replacement of both my hip bones. And just 2 days ago, actually it was on, 2 days ago, I had my first hip replacement. So just so you know, this is an amazing surgery. The recovery time is very rapid. I'm on pain meds, so I'm living that pain med lifestyle of not driving and things like that. But there is a significant difference. Now, I'm telling you all this because I was in a conversation with a friend who is an incredible marketer. He has done a lot of hypnosis products, and obviously very goodwill toward me, and I told him that I was going to be going in for hip replacement surgery. And he said, "Dude, you don't need that, just use hypnosis." And I really didn't know how to respond to that. First of all, he had no idea the amount of pain I've been going into. He had no idea as to what I have been sincerely trying to do to cope with this pain. And it created a good opportunity here for me to talk about what hypnosis is really good for and how it can also be used for things like severe osteoarthritis and stuff like that. Keep in mind, hypnosis is really good at making new associations. So it is very good at taking how you feel about one thing, like for example, smoking a cigarette, and just changing it. It's good at altering how you see yourself so you can build self-esteem, you can build confidence. It's really good at changing how we think about events that happened in our past, so that a trauma that has taken place now just becomes a memory that we learned from. So hypnosis is incredibly good at that, as is its counterpart, neurolinguistic programming. Hypnosis has a really long history of being used for just about anything because it is so uninvasive. It's just making changes in your mind. It can be used for things like physical ailments, and there are some very good documented cases of hypnosis being used to treat things like psoriasis. In fact, I've done it. A person had just severe psoriasis of the hands. It was just red and flaky. You had to wear gloves all the time because it freaked people out, and got a really good result. Now, because you can get a good result there certainly is no reason to not apply it to really anything. Paramedics, for example, are being taught hypnosis to, first of all, calm the people that they're experiencing this physical trauma, but it also has some control over the physical body. Some control, certainly, because you can stop blood flow to a particular area using hypnosis. Now, can you use it to cure severe osteoarthritis? I'm going to say maybe. Actually, you can use it to treat osteoarthritis, but whether it has an effect is going to vary on so many different levels. Hypnosis gets really good results helping people change internal mental associations. It does have a history of helping people with physical challenges So it can be used to change it, to influence it, but to use it exclusively as the source of healing, I'm going to tell you right off, is just foolhardy. I have done just about everything that you can imagine to willfully, under my own control, with hypnosis or not, to cure the hurt that had to lead to a hip replacement. And I did a relatively good job, but let me tell you, after that hip replacement, I am so grateful that I did it, because it is, first of all, so much less mental effort to get a hip replacement and so much greater positive relief. That's not to say you can't use hypnosis to heal. It's just you have to be reasonable. You have to be responsible. So people have asked me, can you help me cure my acne? Can you help me cure my psoriasis? And my response is, I'm not going to call it a cure. It can have an effect on it, and that's going to vary from person to person. And if you're willing to try, you're going to get my very best effort. And we'll see how good we can make this. But I can't call it a cure because that's irresponsible. I will call it a treatment. I will try to influence in the most positive way. And I'm going to leave it up to you to decide whether you want to do that. So I hope that answers, some people think hypnosis is very magical. It's not magical. It's very straightforward. You just get results that seem sort of magical, and so they want to stretch that magic off into so many other directions. My hope is that this little speech here has given you a little better understanding of what hypnosis can do. For those of you who knew that I am going to have the hip replacement and your goodwill, thank you very much. I'm going to have another one, my other hip replaced in about 6 weeks, probably. We'll see how that goes. But again, thank you. If you have questions about hypnosis or about neurolinguistic programming or really anything else, don't hesitate to contact me. I'm more than happy to talk with you. If you want to know about hypnosis, my gosh, if you want to learn hypnosis so you can do something that is going to benefit people, go to Mind Control Publishing. There is the hypnosis course by Jeffrey Stevens that I encourage anyone to learn. And there is the advanced course that I have developed. It's based off of Jeffrey Stevens' work, where you get to work with people over 3 sessions. And in doing that, you reinforce, you improve their self-esteem, and you just get incredibly powerful results. So if you have any questions, please contact me. Once again, I want to thank you, everyone who has shown their goodwill toward me and asked me to get well quickly. It is happening. Thank you very much. And we'll talk again. Bye.